Let's talk about meds, baby.
All right, let's talk about meds. Trigger warning, this is going to be a really controversial conversation, and I want to be very clear
Medication.
from the very beginning. In no way, shape, or form are we telling you to do medication, suggesting that you should or should not. This is simply our thoughts and opinions personally on the situation and my experience as a parent. So let's get started. So I want to start with saying my child is medicated. This was a very hard decision that we made after a lot of things. Like, we tried changing the diet, red dyes, all the things. I mean, I could go through a huge list of things that we tried before medication. But there was an event that happened that was my last decision that was like, okay, it's time for us. So for anybody that has a neurodivergent child, we know that with our friends that are neurodivergent, sometimes emotions are really hard. So if we're talking in neurological terms, inside of the brain, the amygdala, which is the fight, flight, or freeze section of the brain, sometimes is just extremely powerful and overpowers the rest of what's going on in the brain. It makes it very hard to concentrate and use that frontal lobe to make problem solving decisions, and important things are not stored because we are just, all that we can think about is fight, flight, or freeze, right? So when my kids were younger, I think my son, they were in the first grade, so he was 6, and we're at the store. He had lots of just like issues that I mostly controlled inside of our home, our environment. But we were at the store, and it happened to be, we're in the produce section, and there's like that long section where you can get like pre-made party trays or whatever. And my daughter it's her turn to pick the fruit that we're buying that week. And so she picks oranges. I can't really remember exactly the exact fruit. And he wanted a different kind of fruit. And so he's mad and he's screaming. I don't want that. I don't want that. I don't want that. He gets up on top of the little freezer section and jumps off and grabs my neck and is just like dangling and choking me, right? And so I like do the whole thing. I put my arms up, I break him off. He's screaming bloody murder. My daughter's like so mortified that this is happening. And I just walk over to the self-checkout. I check my things out. He's running after me in the parking lot. He's punching me. He's kicking me. I want this. Until he gets what he wants, he is not going to stop, right? People were literally following me out to my car to see like what the scene was and what was going on. And I'm just pushing my cart. My daughter's in the cart, and I'm like, no, sir, we are not. So there was that instance. And then there was the second instance. We were at home. He had gotten in trouble at school for something. And I'm trying to just have a conversation with him about like, hey, buddy, like, this is inappropriate behavior. You cannot do this. This is what we can do next time. Let's try to like exchange the behavior. And he runs over. I'm in the kitchen and our laundry room's like right there. And he opens the dryer and starts slamming his head in it. He's like, I just want to die. And he's just having a full on meltdown. And I was just like, I've tried everything. Like, this is my breaking point as a parent. And at the time, to be very, very honest, my husband did not want to medicate him, but he was out of town all the time. He worked, I think I've said this before, 80, 90 hours a week. He would be out of town sometimes for 3 months at a time, where we would like have to fly or drive and go visit him. He lived in a hotel a lot. So it was just me. And I was just like, I can't do this anymore. Like, I cannot parent this. I'm going crazy. And this kid is not happy. We got to do something. So I go to the doctor's office, and we start talking about medications. And he's like, I'm going to put him on this medication. And I know it was to like try to make me, I don't know if it was trying to make me feel better or if it's actual facts. I have not looked this up, honestly. But the pediatrician says to me, hey, I just want you to know, like, we're just going to try out this medication. But just so you know, he can get off of it probably at puberty. Like, he doesn't have to be on it for the rest of his life. Most people don't need the medication for the rest of their lives. It'll just be till puberty. So I have this like hope as a parent that my kid's not going to have to be medicated forever. Um, and that process was a long process. If you've ever medicated a child, I didn't just stay there with a pediatrician. And I also want to encourage people, if your pediatrician has put your child on medication, go see a psychiatrist. We went to a psychiatrist. The psychiatrist went through the neurological behavior of the brain and like what happened. But I had this like hope in my head. I'm like, oh, this will be fine. Like, it's just for a temporary time for my kid to be medicated. But the hard part is making a decision to medicate. Because if you're a Christian, right? Where in the Bible does it tell me when I'm supposed to medicate my kid?
Yeah. I don't recall any part. The only thing I recall is Jesus coming into the New Testament and doing healings on everybody who had what they called spirits in this, world, overpowering their bodies. But just going back over to like what you were saying, I think the other thing is like there is a lack of education, obviously, with medication. And it's cool to see that you recommended not only seeing your pediatric doctor, but also seeing a psychiatrist. And when I was in my practice, I would actually try to recommend parents to also go see a geneticist, because your body, so not only is your brain working, right, but your body's also breaking down this medication in your liver, your kidneys, and then sending it through your bloodstream and getting it back to your brain and things like that. And I just think that there's just like, it's not a one-stop shop. And there's just like a lack of understanding of like what this medication can do to you. And in addition to like what foods can do to you, right? So like changing your diet is also a huge component of how medication can affect, or even just like how food can affect your mood and your behavior.
That it's so wild whenever you think about it. Because
Yes.
I mean, you and I come from the day and age where like we ate Dunkaroos and Oreos and Cheetos. You know what I mean? Like, you were the
And
cool
those like
kid.
pies, do you remember at the checkout stand, those
Oh
like hot
yeah.
and ready pies that were like, that looked
The
like an
fried pie.
empanada?
Yes,
Yeah.
yes. You could get them cherry, apple. Yeah, if
Yeah.
you were really lucky in the summer, you could get them in peach. Um,
Yep.
but like that is the food that we grew up on. And whenever you start, there's so much research. You and I talk about this all the time because we are really firm believers in that your diet really has so much to do with your behavior and just everything about you. But the breakdown, and I never even thought of that. That's so crazy. I wish somebody had told me whenever my son was little, hey, go see a geneticist, because my thought process as a parent was, I wouldn't, like, if my son needed heart surgery, I'm not having my pediatrician do it. All right.
Right.
I'm going to a cardiologist, right? So my son has a brain deficiency, an issue going on up there. At the time I was like, I don't really know what it is. I'm going to see a psychiatrist. I want to see somebody who studied the brain, somebody who knows what they're talking about, who understands medication. And through the years, we really got super lucky personally, because my husband's doctor used to be a pharmacist. So we got super lucky in that realm of where like I could talk to him about like, oh, we have this medication going on right now. What does that look like and how? And it took a long time. I talk to parents about this frequently, and I think it's important to know, like, just because you start on this one medication, it may not be the medication you need. You can change it up, but there's also this other aspect of you have to give it time, because medication changes your body chemicals, as you were just talking about. Like, it changes your brain chemicals, it changes what's going on inside of you. And you have to be mindful of that.
Yeah.
It's
When
hard.
I was in my practice, I would tell parents all the time, keep a log, right? Like, if you're not keeping a log of like the dosage of medication, because there is a lot of parents who would play with the medication thinking that if you gave a little more, if you gave a little less, the effects of that medication would change. Well, unfortunately, like pills are different as opposed to like marijuana, mushrooms, cocaine,
Right.
ecstasy. They don't give you that like instant reinforcement as opposed to okay, you're taking 0.02 milligrams of guanfacine for the next 3 days. Like you're not going to see changes immediately. And then on top of it, you have to think about like the way that your liver breaks it down, the way that your kidneys break it down, the way that it's digested, all of those different things, because yeah, the physiology of our body and how it's like compounded makes a huge difference on how your body is going to respond. And so I always tell parents, like, keep a log and do not make changes to medication unless you speak to a psychiatrist. So it's not just like, I would recommend a geneticist, a psychiatrist, a neurologist, I mean, a whole team. And then you had the things that you would see, like, you know, ABA, your teacher, special education, OT, SLP, like we all specialize in something different, right? But like that medication thing is just so unfamiliar for me. And so I would never be like, oh yeah, I think this is a good idea, or no, I don't think this is a good idea. I would always say, like, I highly recommend to go to the specialist, because I don't have the scope of practice to give that kind of recommendation.
Right.
Like when I was working in California, it was like, what do you think about putting my son or daughter on THC pills? I'm like, what?
That's a call.
Yeah, that was a whole fad when I left California and went to Baton Rouge.
I have I'm not gonna lie, it has been a conversation that I've had with my child's pediatrician. I mean, we say this all the time. If you've met one person on the spectrum, if you've met one person with ADHD, if you've met one neurodivergent person, you've only met one neurodivergent person. Okay.
Right.
Like, they are all different. Our body chemicals are all different. What works for you, a vegetarian diet might work fantastic. No food dyes might work fantastic. But then I'm over here and like I try that and I get incredibly sick. Right. So it just depends. And still to this day, I will say, what are we in 8 years later with medication? We've been doing medication. We still have to adjust it every time that his age changes, every time that his weight changes, every time that whenever he started puberty, that was a huge thing, right? My body chemicals are completely changing. We have to look at it all the time. I mean, we meet every 3 months to have a conversation, and we've made mistakes on it. You know, there was a time last summer where he was in the main stages of puberty, and we were like, hey, he said, he was like, hey, I don't feel anything on this. I don't want to take it anymore. And I was like, okay. And we tried to go off of it. Horrible. I mean, it was horrible. But it's outside of my scope of practice. I'm just the parent here, right? So I had no way to see what was about to come towards us. I can go on the internet and I can look. And then once things started happening, I started looking them up and I'm like, oh my gosh, we have a huge problem. We got to go back to the doctor like right now and figure out what's going on, right? It's so hard. And I think that's what makes it more difficult for parents and for professionals, is if it's outside of your scope of practice and you're not working with a team, it makes it very difficult. And we talk about this when we talk about sending your kid to school, behavioral issues, all kinds of things. You have to work with a team. Each person on the team specializes in something specific. So if you're missing a member of the team, then you got a crooked table, because I don't know what to tell you.
Right. Yeah, I agree. And like the other thing is like sometimes medical insurance or whatever it is, they put so many barriers behind it. So you gotta find an advocate now to help you like have the right language so that you guys can see those people. Yeah, so the other thing that I noticed too is like with a lot of my history and all of the patients I had seen, the mixing of medication. So like I know that you had mentioned that your son is on 2 different types of medication, but like for instance, let's say not only are they on that type of medication for like their brain, but like let's say they have diabetes. You don't realize that like all of it plays a role, and sometimes like insulin can cancel the effects of guanfacine and you really, I mean, it's
It's
deep.
hard.
Pharmaceuticals is deep.
It is very deep. And my son, I mean, he takes 2 medications for behavioral things, right? But he actually takes 5 medications. So every single day, this kid takes 5. I mean, his doctor and I are always like, we do not want to up anything else because it's so much. But even when my child has a cold, I can't just give him cold medicine. I have to get on there. I have to go to drug interaction checker. I have to look, how is this going to interact it? And I mean, I made a huge mistake. Again, we talk about mistakes. He had the flu one time and we were out of town, and I'm like, I just need to get him some medication so that he can sleep. He could not fall to sleep. His oxygen dropped so low, which if you ever travel with me, you know, I have like a pulse ox, I have a blood pressure cuff, I have like, it's the whole gamut because
you never know what's going to happen. Yeah.
He has a lot of things going on. So like, I mean, we go on a cruise and I have a whole bag full of like, they're like, what is in this bag? I'm like, don't worry about it. I'm your own little doctor. But I mean, his oxygen dropped so low, I had to take him to the hospital. And it was something so simple. I just went to Walgreens, picked up a medication, and was like, here, buddy, you'll sleep so much better. Yeah, well, he was going to sleep really well. So medication is so complicated and deep. And the pharmaceutical industry is so complex.
Yes. And not only that, but like our bodies are also very complex. So like to find like a doctor who's practicing in that scope of practice, not because they're trying to push drugs on you, but to like also just understand genetically what's going on and saying, okay, well, you have a lack of, I don't even know, enzymes for this or mitochondria cells to whatever. I didn't pass physiology, so I'm just throwing words out there.
Let's just be honest.
I took them and it was hard.
They are hard.
Anatomy was my thing. I'm like, oh yeah, that's a tibia.
See, and I'm like, anatomy, no. The brain, yes. I will. Like,
chemicals were,
yeah,
just chemical compounds and how they intertwine in our body and just like the understanding. Yeah.
I do want to touch on deciding on medication and how difficult that is. As a parent, I get teary-eyed whenever I just bring it up. I want to say to parents, just, there is no shame. Like, and I searched the Bible and I tried all the diets and I did all the things. And finally, my pediatrician said something. He says it to me every once in a while because he knows that it's really hard for me. And sometimes I'm pushing, like, maybe we should get off. And he's like, you don't get to decide now. He's becoming an adult. It's a conversation between me and him. But he would say to me when he was little, if your son had diabetes, would you put him on insulin? Yeah, you would. So just because it's something you can't see doesn't mean that he doesn't need the medication for it. And it's okay to come to a point where you say, I've tried the diet, I've tried the exercise, I've done all the things that I needed to do, and we're still at a place where they are struggling. And now that my son is a little bit older and we talk to his doctor about the medication changes, he'll say he can see how it helps him. And he'll say, like, it really affects the way that I'm able to hang out with my friends and talk to my friends. If I'm not on medication, I struggle really hard to like follow their conversations or control myself to not just do outlandish things, right? Because he does have that strong impulse within his amygdala to just just do whatever comes into his head.
Yeah. Same.
What, like whatever. You and I have intrusive thoughts, but our body chemicals have allowed us to develop the skills of self-control. There are people that they don't have that, right? The body chemical, the chemical they need to develop that self-control is not there. So that doesn't mean I don't teach my kids self-control. The medication doesn't make the issue go away, right? It does suppress the urge, right? And then allows that frontal lobe to ting, this is a bad idea. I'm going to have to practice self-control. I probably shouldn't put mustard packets under my teacher's shoes to where mustard squirts all over the room. Like hilarious, yes. Appropriate, no. Right? So if you're in the position where you're like, I've done it all, like I have tried it all, I'm at a breaking point, I don't know what to do. You're on the phone with your mom crying, like, I just can't take one more day of this. Know that you're not alone and know that there's no shame in it. There is no shame in getting your kid the help that they need so that they can be successful.
Agreed. How has he reacted to the medication? Not in a obviously in his physical state, but just like has he had thoughts about his medication and asked questions as to why he's taking the medication and like when he could stop the medication? Like,
I mean,
does he have those surrounding questions in regards to his meds?
absolutely. Absolutely. And like I said, he went through a period last year at puberty, because we had this hope that puberty, you're going to be able to get off the medication, it's okay. That had kind of gotten us to puberty, and then we got there and he's like, I want to get off, and I'm like, okay. So we got off all summer long, and again, as I talk about all the time, I was able to control the environment, right? I was able to control the home, but I didn't notice little tiny ticks, right? So he has this he doesn't have it now, had this desk, and it had like a film over the top of it, like it was like a black plastic, and he had like sat there and like picked all the plastic off until like the desk was like nothingness on top. And I didn't think anything about it. I'm like, he's just bored or whatever. Well, when he started having other behaviors and I went back to the pediatrician and was like, whoa, we got to do something. I started explaining that situation to my pediatrician, and it's super interesting. He said, imagine if someone was tapping a pencil, right? You can stop a tapping pencil, but inside of his brain is a tap. And the only way to stop that tap is to fire off another section of my brain, right? So how do I do that? I pick, I cut, I do different things. Like there's a bunch of different things. You can do a lot of research into what this might look like, right? But I have to do something else to stop this and to fire off a different section of my brain, because what was happening before was the medication didn't stop it, but it slowed it down enough to where my brain, right, and all your neurological pathways.
Yes.
Yeah. So it slows it down enough to where another neurological pathway can now come through and push me to a different part of my brain. Well, when I take that medication away, we're just tapping. And it's not slowing down enough for another area of my brain to fire. So understanding, again, educating yourself on what is happening inside of that person's brain. And it's so hard because we can't see it, right? I can see if I'm getting too fat. I can see if I shouldn't do something wild and outrageous, or I can see a cut bleeding, but inside of someone's brain, you can't see there.
No.
So I don't see that tapping. I don't see that constant firing of that pathway. So I can't help them. And what I've learned through this process is I can't see it and I can't feel it, but he can. So what's my job? He needs to be educated. He has to educate himself. We have to make sure that we're saying, hey, buddy, you're doing this right now. Do you notice? Okay, what do you need to do differently? Have you taken your medication today? Have you done this? Have you gone? He has outlets. We've developed outlets. Skateboarding is his outlet. So I'll say, have you taken your medication? Yes, you've taken your medication. It seems like you're still struggling. Have you gone for do they call it a ride on a skateboard? I don't know. It's a ride on a bike.
Dude, we are so old.
I know. And he would make fun of me. I'm like, I don't know. Have you ridden your board today? Whatever it's called.
So
like,
hip.
Hey, don't be going there. But you know what I mean? Like there's different things, and we've had to, and he'll say when he was younger, it was soccer.
Mm-hmm.
Soccer was a great choice. It doesn't require any type of social interaction, right? I'm on my own. I'm focused on this ball. I'm getting it. When the pandemic hit, that quit. And so he had to pick something else up, and he picked up skateboarding. Those outlets, just like you and I, like it's important that you and I like exercise and do things. I find if I have a really hard day at work, if I walk home instead of driving home, oftentimes I feel so much better. Right?
Yeah,
I got that
grounding.
Yeah. Yeah.
Like grounding moments. Yeah.
Yeah. So I think it's just developing and making sure that he's educated more than anything else. He's asking questions about his medication. And if you have a good pediatrician, that pediatrician will let you know, hey, it's kind of that point when it's time for him to start advocating for himself. I cannot talk highly enough of my pediatrician, but when we go in for those appointments where he has to talk about medication every 3 months, it's between him and his pediatrician. The pediatrician, he's educated, he knows the questions to ask. He'll look at me and say, Mom, is that true? Or how do you feel about the situation? Right. But for the most part, it's my son advocating for himself and recognizing, yeah, that does happen, or no, that doesn't happen. So that when the time comes for me not to go with him, he's ready.
I love that. While we were talking, scripture that just kind of popped in my head is 2 Corinthians 12, 9 through 12, I believe. And it's where Paul talks about like the thorn in his side. And like, I think a lot of what we go through in our life, right? We try to relate to like what that thorn is. But there was a scene I had watched out of that show, The Chosen, and one of the disciples had asked God or Jesus in that moment of like, hey, like I've watched you heal all of these people and you're asking me to heal other people as well, but I have like a limp in my leg. How come you haven't healed me? And Jesus in that moment was like, he just said something like, it's because you trust me and I've called you to do this and this is your assignment. So I just think in these moments that thorn in our sides, or whatever we want to call this, is like very circumstantial as opposed to like what's deeper, and it's what Jesus has called us to do, right? Like he trusts us enough. And then he even told the disciple at the very end of the scene, he goes, when you meet me in heaven, you will not have this. So just be patient and wait and be obedient to what I've called you to do.
My mom and mother-in-law are so wonderful. Sorry, I'm going to tear up. But I can't tell you how many times when I've called and said, why are we going through this? Why does this have to be my kid?
Yeah.
Why does he have to do this? And my mom will say, if he doesn't go through these struggles, how is he going to be able to help people when he gets older? This kid has the heart of gold, and he sees people in such an amazing way. And when he talks about what he wants to be whenever he gets older, she's like, these life experiences and the things that he's going through are developing him for what God has called him to be. Don't stifle them, embrace them. It is a thorn in our side. I
love that scripture. It's very moving. Yeah.
More than I can even
just
say.
the scene out of like obviously that show, right? And just the way that like that disciple came to him so humbly, and he was just like, why haven't you healed me? You know? And then there was like multiple scenes later of just doubting Thomas, and Thomas getting upset about why his wife wasn't saved because he had just witnessed Jesus raise Lazarus out of the grave. And it's just, again, you have to believe in the mystery of your faith. At the end of all of this, there is something greater than you and I, and it's just to admire the creator. It's hard.
Yeah.
And I think this is like one of those times.
In this life, there will be many troubles, you know? He did not promise us to have this like nice, cushy, amazing life where everything goes perfectly and we look beautiful all the time. These are the ugly scars underneath, but those scars are what develop beauty. I have this, this is off topic, but I have this sunflower that has been growing. It was like a volunteer sunflower in my flower bed that's like taller than my fence. Well, the head of it died, so I cut it off. And I was like, oh, the leaves are dying. So I started cutting the leaves off. Well, what has happened is now all these sunflowers are coming out from where those leaves were. And I was like, this is such a perfect picture of life. Like we talked about this earlier. Nothing goes as planned. We planned this one big, beautiful sunflower that's supposed to be. And what it took was a bunch of pruning all around. And now all of a sudden it has like 10 sunflowers coming out all over it, right? On this one stalk. But I do believe whenever we're looking at our own lives, when we're looking at our kids' lives, that if we will follow and we understand this life is going to have troubles, I'm going to have thorns in my side that I'm not going to heal from. Maybe I may be healed from them. I may not be healed from them, but God is going to use them in a profound way for his glory.
Right. He's trying to draw you closer in all of it too. It's like, come to me with this thorn.
Yeah. I love it.
And don't look at the thorn and look at the assignment. Sometimes I'm like, buddy, should I catch a break?
Breaks are nice. They happen sometimes. But growth comes out of difficulty. It just does, right? You have to go through the birthing pains to get the baby. So that's just how it works. We're so glad you guys joined us today. Thank you so much. We hope that this was inspiring to you and that you have found a little nugget of truth inside of it that you can apply to your life today. We look forward to seeing you next time. Have a great week, guys.
Thanks.